नमो बुद्धिमतां वरिष्ठाय भवतां हार्दं स्वागतम् अस्मत् अगस्त्य गुरुकुल परतः चाय पे चर्चा सरण्ये। अद्य भवताम् अतिथिरूपेण समाननार्थं वयम् अत्र सम्मिलिताः। अगस्त्य गुरुकुलस्य अष्टमकक्षायाः छात्रोऽहं नरोत्तमः। श्रीमान् गीताकृष्णन् गोपालकृष्णन् पिळ्ळै एषः महाभागः अधिकारी अस्ति। ट्रेडिशनल कॉम्प्लिमेंट्री तथा इंटीग्रेटेड मेडिसिन विश्व आरोग्य संस्थायाः प्रविभागे भारतस्य आयुर्वेद युनानी सिद्ध योग सदृशी सांप्रदायिक औषधानां विश्वस्तरीय नियमकरणे एषः महाभागः मुख्यदायित्वनिर्वाहकः विद्यते। इदानीम् एषः महोदयः सांप्रदायिक औषधवस्तूनां तौलनिकं तथा डेटा अभिवृद्धिः इत्यादि विषये व्यग्रः अस्ति। योग इत्याख्यस्य विश्व आरोग्य संस्थायाः मोबाइल ऐप निर्माणे अस्य महत्योगदानम् अस्ति। मूलतः आयुर्वेद वैद्यः एषः महाभागः मिश्र सांप्रदायिक तथा पाश्चात्य औषधीय पद्धतिः एतादृश एकस्य विख्याता चिकित्सा विभागस्य 9 वर्षपर्यन्तं निदेशकः आसीत्। एषः अनेक संशोधप्रबन्धानाम् अनेक लेखनानां च निर्माता अस्ति। एषः आयुष इत्याख्यायाः भारतसर्वकारस्य समितेः कोविड-19 मुख्य सदस्योऽपि विराजते। एतादृश विशिष्टव्यक्तिना सह अद्य वार्तालापं कुर्वन्ति अस्माकं गुरुकुलस्य आधारस्तम्भेषु अन्यतमाः डॉक्टर अर्चना पुरुषोत्तम सीमन्तिन्यः। बेलर वैद्यकीय महाविद्यालयस्य नाडीतज्ञाः नाडीविज्ञानसंशोधकानां मार्गदर्शकाः च एताः सन्ति। Namaste and welcome to this edition of Agastya Gurukulam's Chai Pe Charcha series. I am Narottam, a student of Agastya Gurukulam in the 8th standard. It is our privilege to have with us as a guest today Shri Geetha Krishnan Gopalakrishnan Pillai, an officer in the Traditional, Complementary and Integrative Medicine Unit of the World Health Organization. In the WHO, he is responsible for developing global goods supporting norms and standards of traditional medical systems such as Ayurveda, Unani, Siddha, and Yoga. He is also currently engaged in developing data, analytics, and impact assessment tools for traditional medicine. He leads the development of the M-Yoga mobile app for WHO. In cooperation with WHO's Digital Health Department, UN International Telecommunication Union, and other organizations. Dr. Geetha Krishnan is an experienced Ayurvedic physician and has clinical and research credentials in integrative medicine, integrating traditional and Western systems of medicine to optimize treatments for patients. For 9 years, he headed one of the earliest and best known integrative medicine facilities in India. As a researcher, he has several research projects and publications to his credit. He is a key member of the Ayush-based COVID-19 response task force of the Government of India. He will be interviewed today by one of our board members, Dr. Archana Purushotham, urologist and neuroscience researcher at the Baylor College of Medicine, Texas.
नमस्सर्वेभ्यः धन्यवादः नरोत्तम सर्वेषां चाय पे चर्चायां स्वागतम्. Welcome to Dr. Geetha Krishnan, who is our special guest today. And it's a real pleasure to have you here to speak about Ayurveda and its role in current healthcare systems. So let's start with a little bit of background about your career path and what you've done so far. What drew you to studying Ayurveda?
Yeah, that's a great question because for me that takes me back to my times when I had to start, or rather when I finished my college, or at that time it was called as pre-degree, where it was the 12th standard, and then was trying to become a doctor in the modern medical fraternity. And I also got a seat in one institution, and simultaneously the results of the Kerala entrance also came. While I was preparing for moving to this institution, when when my father, who was a staunch believer in Ayurveda, decided that I should go for Ayurveda. So even though reluctantly, I came into the area of Ayurveda, and then finally, it made like it's a passion for me now. It's still, so it is something which I think I would have missed if I had not been inducted into it. So I am thankful to my father throughout my life for that. So that's a so that's what brought me into Ayurveda.
Sometimes parents not letting us do what we want at sometimes turns out to be a good thing, I guess.
Of course, really.
So then within Ayurveda, what did you do after you studied your, basic BAMS? What did you do then? And how did you get into integrative medicine?
Okay. As soon as we finished, or rather finished the Ayurvedic basic graduate course, I started a hospital in Kerala, in Trivandrum, where of course where I was studying also. And as soon as we started the hospital, I got admission for a postgraduate degree, which was I got admission for Dravya Guna Vijnana, which basically translates into modern medical pharmacology, or which includes clinical pharmacology also a little bit. So that's how we could translate it. Uh, I studied there, but simultaneously I was also running this hospital, which gave me a lot of insights into managing patients and working with patients. And uh, really, I think because it was not a clinic, where it was not an outpatient clinic where we had about 16 to 20 patients every day at our hospital. It created a situation where you had to see all kinds of difficulties that the patient faced, and as a clinician, Ayurvedic doctors also faced. And I could find answers to this, which were available with my colleagues who were practicing modern medicine. Some of them were practicing homeopathy, some of them were practicing practicing naturopaths. So I was able to find synergy with all these people for the requirement of the patient. And I think I started working towards the goal of achieving the patient satisfaction, and not and I was the main provider of the patient satisfaction. I was deciding how much of what should be brought into this, etc., etc. This was happening very early in my formative years of as a practitioner. And I think that had a huge influence when we set up this hospital in Bangalore, which are a 30-bedded facility for Ayurvedic patients, which was the hospital in Trivandrum was an independent Ayurvedic hospital, whereas a hospital in Bangalore was a part of an allopathic hospital. So it was a 90-bedded hospital, where 60 beds were for modern medicine and 30 beds were for Ayurveda. There also, I would say it was co-located facility, where instead of trying to find an allopathic counterpart who might be able to take care of a very severely ill patient, which I was having admitted in my ward, I didn't have to run around trying to bring them to the hospital, because they were already present in the hospital. But the benefit was that my allopathic colleagues started seeing that there is a benefit to what I was doing. So then there was some kind of a cross referral, and then it was not intentional. If somebody with stroke came, and they had seen. So I had admitted a stroke patient, and I had called a neurologist to come and help me. And then the neurologist saw that what I was doing, and then when he or she admitted the patient, they also started calling me, okay, can you do something here, because we are in the same institution. So this was not deliberate, and it was not an integrative medicine idea at all, which was running there. But simultaneously, because I had this pharmacology background, I actually started working on developing a medicine which for diabetes, which I developed. I don't know. I took patents for it, etc., etc. And and I was doing the marketing was quite unique, because we used to market by saying that you buy one product and we give you a free diabetic checkup at that time. And after 1 month, we come to your home, and we deliver, like we do one more checkup. And if you don't find the benefit to your, like to your satisfaction, we give you another product, like, so you don't have to pay for it. So that was a way in which we used to market. So it was in Bangalore, and it was going quite well at that time, like in a small scale way, like for a small scale manufacturer, it was a good manufacturing facility, and a good sales process. So this was taken up as a innovative idea by one magazine in India called The Week magazine. So in 2006, they published a 2.5 3 page article on what I was doing in diabetes, and and this was quite, like, it was not like Ayurvedic medicines were not so proprietary. Ayurvedic medicines were not so clearly being used or widely being used by the community at that time for management of diabetes. But this was very focused kind of a like marketing. So they published this, and around 2007 middle, some Dr. Naresh Trahan from New Delhi, who established this institution called Escorts Hospital, which is one of the premier cardiology hospital ever
Mhm.
established in India for the first time. His office called me, and saying that he wanted to talk to me, and asked me, and he on the phone asked me, like, when are you coming to Delhi, or do you visit Delhi? Which of course I used to, because my family was in Delhi at that time. So I said I usually come to Delhi. And he asked me to go and meet him. And I really didn't know what was the reason why he called me, or when he called me. And I really did not know him also, because he was not like, I was from Kerala, and I was in Bangalore for almost 4 years, but I never had the understanding of what was happening in Delhi at that time. So he come over there. I went over there, and he gave me the vision of a institution which he was setting up, which was an integrated medical facility where all systems of medicine will work together for the benefit of a patient. He told me that, and then he asked me to give my opinion, which I went back, and I studied, made some suggestions to him, and he liked it, and he asked me to join him, as because there was no way in which I could join Escorts Hospital, because he was the CMD of Escorts Hospital at that time. He said, okay, I'm going to employ you as a consultant. And he employed me for more than 14 months at a stretch as a consultant, to develop a concept on integrative medical establishment. And so from actually I started from zero at that time. I had probably had some interactive capability or history with allopathic colleagues, but no real thoughts about how it really works. So it made me travel across different parts of the country. I also had an opportunity to travel outside the country 2 3 times to meet people and discuss with them, find out how things are happening in other parts of the world. And I would say I came into integrative medicine because I came into Ayurveda because of my father. If I came into integrative medicine, it was because of Dr. Naresh Trahan. Like I can be very clear about it.
Very foresighted of Dr. Trehan to have seen the future in integrative medicine. That's great that you started then the integrative medicine unit. Did you face a lot of barriers? How did integration work there? Was it similar to the previous hospital, or was it integrated in a different way, in a better way?
um, I would say it was better. The reason being, here it was not I was able to create a system where evidence were regularly collected, presented, and based on the evidence of benefit, more patients or more more referrals were got by me. So in the beginning, when I joined Medanta started in 2009 December, and I joined something around 2010 March, and all. So I had very few patients. To be frank, it was a huge humongous, multi-speciality allopathic hospital. Nobody even knew that Ayurveda was there. So I was just sitting there, and then I started discussing with people, and I slowly started getting one or two patients in a week, etc., etc. For the first 2-3 months, it was like that. But then it was interactions with other people. It was basically research projects which we were able to put forward in ethics, for ethics approval and IRB and all, where other doctors came to know that Ayurveda is an available option in the hospital. Most of them were critical in the beginning. I should say that the most supportive in the hospital was only Dr. Trahan at that time. I had been, I cannot name, but there were very senior doctors in the hospital who had told on my face in the institutional review board meeting where I was trying to make a presentation on Ayurveda, on a research project on Ayurveda, that Ayurveda is pseudoscience and it has no way it is going to be presented here, and we are not going to take it up. So again, I should tell, the person who suggested that said that, you understand, even Lancet talks bad about pseudosciences like homeopathy and Ayurveda. So it was at that time, Dr. Trahan is not a part of the IRB, but he was part of that particular meeting because of some other clinical presentation that he had. And he said that, that is their perspective, like that is a perspective of a different group of people who doesn't understand how we use our life, and our life is our life and we live our life in our way. So it has a lot of difference. We need to understand the perspective difference in culture and society and the needs of the people. So Ayurveda is a part of this history for thousands of years, and we will continue to move forward. So Geetha, don't worry, you go ahead and let us see what happens. So that's what he said. So again, so in the initial phase, I should say, it became a success in Medanta because of the huge support of the institutional head. Like I should say that. But I was able to stand on my own foot probably in about 6 months time when I started getting my own patients. So maybe like I see around 40 patients a day. So like I get my average would have been or ratio would have been about like 30 or 35 coming directly to meet me, and about 5 of them coming from referrals. But by the time I left Medanda in 2018, I would say that almost 99% of the patients whom I was seeing, because by that time we were seeing patients in the ward and and in critical care and other places. So 99% of the patients whom I was seeing was all referred patients, referred for very specific conditions by allopathic doctors. So that was a change which had happened, and that happened because of the attitude of that hospital, of that institution. It would not have happened otherwise. Like I don't think that it is replicable easily in other places, because that attitude is difficult to be replicated. That is not because of the technical and the infrastructural facilities not being available, but the attitude is very difficult to get.
This experience of yours that you're talking about, where Dr. Trehan almost was single-handedly, made this happen, reminds me of a saying. I may not be able to paraphrase it, to say it exactly, but to paraphrase it, it's always a small band of committed citizens or committed people who bring about change. In fact, nothing else ever has in history. So that's beautifully demonstrated in this situation that you were talking about, where he stood for Ayurveda throughout against others' criticism. So you were talking about specific conditions and a lot of research protocols that you did. So were there particular diseases or conditions that you found Ayurveda particularly successful in while you were there?
Yeah, if you ask me about diseases, then I would say like some of them were joint related problems, especially low back pain was something which I used to get a lot of reference from the neurosurgeons, because they would write and say that meet Dr. Geetha Krishnan and for an Ayurvedic review, and report back after 3 months of treatment, if it is not positive, if the results are not positive. So that was the way in which it was written. So we used to get that kind of referrals from the neurosurgeons, and that was really good, because it was a very good way of belief that was being shown on our contribution to the hospital. Another area was osteoarthritis knee joint. I did not get osteoarthritis knee joint patients directly from the orthopedicians. Of course, I used to get, but in comparison, I used to get it from the cardiologist. This is a very good way of looking at it, because many patients want cardiology consultation and approval for going for a surgery. Okay, now they come for a cardiology consultation because they have osteoarthritis knee joint problem. They come to a cardiology consultation, and the cardiologists say, no, you cannot go for surgery. And then they say, okay, now you don't go anywhere else. You go to my colleague here, and he will take care of you. So this is how, even though indirectly from the orthopedician, we used to get the direct referral was from the cardiologist for orthopedic patients, because they were the people who really decided whether somebody is going to have a surgery or not going to have a surgery. And those people who couldn't have surgery were referred for Ayurveda. There were several other, we had very good success in management of dengue fever in Delhi. So we did that study with Central Council for Research in Ayurveda. And also it was once we did the completed the study, that same drug or same combination was taken up by ICMR. We presented it to ICMR took it up, and then ICMR independently did the same study in the Belgavi unit, and found that what we are saying is true. So that is the time when I had the first opportunity to work with Dr. Soumya Swaminathan also, while she was the DG of ICMR. But more importantly, this was I worked with my colleague and very good friend, Dr. Sushila Kataria. She was the internal medicine specialist there. So I and Sushila had worked together in several clinical trials. One of them was this dengue fever. Another one was in the management of pre-diabetes in patients, or prevention of diabetes in pre-diabetic patients. Then another one was management of infective diarrhea using Gurgaon has usually has typhoid. I mean, many in specific seasons. So we used to treat such patients, and we used to avoid using or our aim was to see how many patients we could manage without giving an antibiotic. That's what we were trying to do. So we were pretty good in that, and the results were good. But the best thing about that is this comes from real traditional knowledge, not even from directly from Ayurveda. Like it was, we used our simple aim was to find the right dosage of the number of guava leaves one has to consume to manage infective diarrhea. So that is what so we did a titrated dose study to find out how many doses we had to take, etc., etc. It was good. So we found that 14 doses had the best effect, and it is as good as some antibiotics which were given to patients.
This is amazing to hear. So has all this been published in peer-reviewed journals?
Yes. At least I think dengue has been I don't know whether ICMR has published it, but we had given the report to ICMR. And I think CCRIS has published it, because we did the study with CCRIS. Then we published this guava study we had published. The study on pre-diabetes was a sponsored study. I don't know whether the sponsor has published it or not yet. I didn't see it, because if it had been published, they would have actually, because I was the investigator in that. So of course they should have come back to me. So they have not come back to me yet. So I don't think that it would have been published. We published another one on pain management. So then comes symptoms. So let me come to, instead of diseases, let me come to symptoms, in which we had several benefits, or several areas were being managed in that. So what's it called? One of the symptoms were pain management, so which we work quite well with surgeons. So especially with robotic surgery, because the only reason with robotic surgery, because the robotic surgeons sat just right across to my room. So like we used to we were quite friendly with each other. He's Dr. Ali Zamir Khan. He's a very well famous robotic thoracic surgeon. I have seen him in flights only most of the time. He's a wonderful person, very open hearted, open minded person. And Dr. Khan and I used to chat, and one day he walked in and asked me, Geetha, you are telling me about all this pain of knee joint, etc., etc. So do you have some problem? Can you manage pain for one of my patients? So he had patients who has this, this when they put the robo on the chest, there are the sports which actually drill into your, like into the rib cage, and and it and the ports go under the rib, each of the rib bones, because I think I am not being too technical here. So once it comes out, scar tissue is formed over there, and this scar tissue sometimes, or in many occasions, catches hold of a nerve which is also going very near to that. And this nerve, when get caught in the scar tissue, causes pain to the patient. It's a kind of a neuralgic pain which patients cannot manage in any other manner. So I have seen patients, coming with their shirt not touching their chest, so they will just hold on to the shirt because it's so painful for them. And usually the he used to give painkillers, and he knew that these painkillers are not going to work because this is something which is a constantly irritated nerve which is causing the problem. So he just came in and asked me whether we could do something, and this is something totally new for me. I said probably I will try, and we tried some external application of Ayurvedic medicine and some internal medicines, and we found excellent results with that. So we published that, that in the Journal of Thoracic Surgery, we published that paper, and it is well received. So then after that, he does wet lab training for robotic thoracic surgeons, who are upcoming robotic thoracic surgeons. So whenever he does that, he usually calls me in for a 2-hour lecture on how we do it. And so it is quite easy. So we what we did was, initially the patients had to come and stay in the hospital or stay near the hospital for this management. So it's 7 days of this simple therapy. People have to come from far off, and it's a very costly affair for them to stay in Gurgaon. They come from many parts of the country, and they're already like burdened with money, with the problem of money. So we didn't want to do that, because we had to give this treatment, and the way in which we were doing in the beginning was not possible for them to replicate at home. So we made a simple process. What we did was, we started we simplified the process. Then on the first day, we called the patient along with the relative. We videographed everything that we are doing on their mobile phone and gave it to them. And that was our intervention. Like, so it was a 40-minute intervention. We just charged for that single day intervention, and we sent them back. And like, it was not as intense as the kind of 7 days treatment we were giving, but this is a long-term problem, and it's not going to go away in 7 days, even though the perception of pain might come to zero in the 7th day, but it's actually not going away. So we taught the patients how to manage it themselves. So now I think we would have done for hundreds and hundreds of patients in this particular manner. So we had an innovative way of reducing the cost also for the patient. So it was quite appreciated by people. And then he came in and asked me, okay, you see, we have these patients who have their, because he take out a lung, and then there is a cavity in that place, and if you leave that free, then the fluid oozes in, and there could be possibility of infection, etc. And the drain, like, you have to, there is a drain which is kept there to take out fluid, so you might have to keep the drain for a longer period of time. And Geetha, do you have something to help me out in this? So then we sat together. I had never seen a robotic thoracic surgery until that time. To be frank, I have never seen the chest opened until that time. So he called me, he took me into the surgery. He told me, okay, this is what I am doing. You see this cavity here, and this is what I want. So I understood, because he was telling me exactly what he wanted. I understood exactly what he's expecting from me. And then I had a very good yoga practitioner with me. So I said, okay, you want this to be expanded? You want this place to be filled up? without, not with fluid, but with the lung. So let us see what we can do with that. So we started doing yoga for these patients, and it was experimental in the beginning, and we found that we were able to take the patient out of the intensive care unit, post-surgical ward, uh, 24 hours before what the patient earlier, than before, and than before our intervention. So it was a big advantage for the patient. So now it's his routine was, patient comes in the morning for surgery or one day before the surgery. The yoga instructor teaches the patient the yoga to do. They will not learn yoga in one day, but it's very simple breathing procedure. We tell them, okay, you would please remember this is the breathing procedure that you have to do. That's all. It's just an introduction to it. Patient goes to surgery. The patient wakes up with the yoga instructor by his or her side. So the yoga instructor is placed there as soon as the patient wakes up. The Dr. Khan or Dr. Khan's colleagues calls us, says that okay, the patient is waking up. The yoga instructor goes there, sits there, and tells the patient, okay, you remember I told you to breathe, so start breathing in this manner. And this was really a tremendous success, and we included that also in our paper on and that is actually really good. So I think as an intervention, robotic surgery, pain management is something which we could do, which could improve patient what's it called outcomes in robotic thoracic surgery in many ways. So these are two ways where we used to work. There are several other, for example, another one is um, sensory neuro hearing loss. So I had a friend, Dr. Shashi. He is a ENT surgeon, and he also so he is now the head of another hospital's ENT department. But while I was there, he was at Medanda, so we used to work and joke quite a lot. And so I was telling him about what was happening with some other patients. So he told me, okay, do you have something to do for this particular problem where the patients who had been taking some TB medications have this sensory
neural hearing loss.
hearing loss. So do you have something to do there? Like, I don't have anything, and we are trying to give a steroid injection directly, and then but some patients benefit, but very few, like in the total number. So if you have something, that's something which we are totally happy to send to you. So I said, okay, you start sending those patients, and we found good benefits in 2-3 patients, and especially those chronic patients who had been suffering from this for almost about 2 years, 2.5 years. And he then started sending a lot of patients with the same condition. So, but also for other conditions later. But for the specific conditions, he started sending a lot of patients. So I think even after coming here, I see over phone one or two people about their problem, and now we have a standard formula of medication and everything. So we make some changes in the dosage forms and or the way in which the medicine is taken, but it is almost the same medicine. And we get I think I and Shashi, we get about 80% of the patients are successfully treated now. So at least they are comfortable. Probably the left ear is not hearing as much as the right ear, but that is not a problem. They are not completely deaf, so they are happy about it, and it's make a lot of difference to them.
Just amazing. This is just amazing. I mean, I had come across your article on robotic surgery and Ayurveda, and I had wondered, how can Ayurveda contribute in something as high tech as robotic surgery? It seems to be the very antithesis of Ayurveda. But to hear, neuralgic, that is nerve entrapment pain, I know it's we just write it off. All that we can do is give them pain medication. There is really no hope for it to go away unless some miracle happens, and naturally it may decrease over time. But it never really goes away, and these patients are stuck on medication. And so our job is to just keep writing those prescriptions year after year after year for them. The same thing with
similar one is chronic pelvic pain syndrome. So we had so we had urologist working with us. So We found some excellent benefit with chronic pelvic pain syndrome also. So I think in neurological origin pain, we probably have something to do, sometimes through medication, sometimes through external applications. So that seems to be a very strong area for Ayurveda to intervene and work with allopathic medicine. And even this sensory neuro hearing loss is also something which is quite to be frank, I have never treated that before until the day Dr. Shashi asked me whether you can treat that. So
Yeah.
the fact is Ayurvedic science is so flexible and malleable, and so like deep, that you can find a solution for any situation you put yourself in, like it.
Even a completely new condition that you had never treated before, you just use the theory you had and you could develop a
Exactly.
treatment. That is just
Exactly.
fantastic. And sensory neural hearing loss is the other thing. This is the typical old age hearing loss for
Yes.
our listeners who may not recognize that term. So this is very common. All of you would have seen this with elders who go deaf over, after maybe 60s or even older. It's even more common. Again, this is something we don't even pretend we can treat. Uh, Either, the only option we have is hearing aids. Otherwise, this is we assume the ear has reached its end of life before the body, and so nothing can be done. So it's amazing to know that
Uh,
you could actually come up with something that worked.
Another intervention, I don't know whether I'm, is it being too much, but basically there are a few more which I can, if you want to hear that. You can stop me if you want me to stop.
No, please go ahead.
So another intervention was idiopathic thrombocytopenia. So like patients with very low platelet count, we you won't believe it. I got this information from a WhatsApp group. That at that time WhatsApp was just beginning, and people who have just started using WhatsApp. And one of the first information that I got was you give papaya leaf juice and you get platelet count increase. Okay, so what I did was I had a friend who was in pharmacology. I sent it to him and asked him to see whether it has any benefit on some rats. So he did some there was not like he had some rats available with him in the lab. So he did, and he said it seems to be there is definitely some benefit seen in the rats. So let us see what happens. So we tried papaya whole leaf juice. We tried without the big veins. We tried different quantities of papaya. We tried because it's a little bitter. We tried different ways of making it more tasty, etc. And the number and the frequency of medication also. We tried all these things, and we identified the right dosage and the right frequency for the medication, and the benefit also. Like, so if we give papaya leaf juice to a person at 5 ml with some little bit of honey or sugar, if you don't want to take the taste of it, the effectiveness can be seen in something around 36 to 48 hours. So if you have somebody whose platelet count is something around 12,000 or 10,000, which is a very low number, you start giving papaya leaf juice to this patient twice a day, you will find the number raising to something around a lakh in 24 to maybe even before 1.5 days. And by 72 hours, you can definitely bring the person back to 2 lakh, the minimum requirement. And this we initially started with ITP, but then we started giving it to patients in chemotherapy also. So so this is another problem with chemotherapy, and so we
Yes.
started giving it to
Yes.
patients, and they also found benefit. So like you find something useful somewhere, you can actually, because we are not bound like modern medical medicines, like you can use it in very specific condition. We are unbound creatures, so we can use that in many places. So we used to try doing that in different situations, and we found it very effective. So I'm not saying that all WhatsApp group informations are right. I have tried several other, but none of them were right. But this was right, and I realized that I should have checked for the literature first, because it was available already in the literature. Malaysia had already published that. It was already a published paper and there was already published paper. I didn't have to do all this experimentation on patients before I found the right dosage. But of course, they had their publication was on animal study, and it was not really clinical studies. So, but this data was available because at
This
least,
is
yeah.
So is this the same thing that you used for dengue as well? Because in dengue also you have the low platelet count. So is this the same papaya leaf juice that you used for
No,
dengue?
no. In fact, in dengue, we used papaya leaf juice when the platelet count went down. But in dengue, we used a medicine called as Pitta Jwarahara Kashaya. Uh,
Okay.
we think dengue is a jwara, which is a name for fever in Ayurveda, or in Sanskrit, and which has all the three elements in the body, or doshas in the body, which are factors with which we can understand how a body is functioning. So we think that all the three all the parameters in the body which affects all the three factors of the body are combined and are not properly maintained, or all of them are in a situation of agitation.
They're all in disequilibrium.
Yeah, so I was actually trying to not use that disequilibrium, because equilibrium means it might mean they are all always in the same quantity or quality,
No,
etc.
no, I understand what you're saying. Yeah.
Its own quantity and quality. So it is somehow agitated, and and in combination with each other, and in that pitta, which is the element, or the parameter which gives heat to the body in a very general sense, has gone up. So there is a specific medicine for pitta jwara in Ayurveda, and that is what we used over there. And
Okay.
benefit what we found was, so dengue was also, like, very, 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 it's endemic to Delhi, and a lot of patients happen whenever dengue season comes in. So that year when we did the study, there were a large number of patients in Delhi, and we used to admit only patients who required hospitalization. Somebody just having dengue fever was not admitted in the hospital. So, like, certain parameters which, especially after their ultrasonograph, and their peritoneal fluid, etc., after looking at them, and thinking they might go into a situation where they might require urgent critical care, only such patients were admitted in the hospital. And most of these patients somehow went into the critical care, or for a few days, or maybe 1 or 2 days. uh, what happened, we did for 94 patients, and not a single patient got into the ICU. Not a single patient, like, in this
That's
medication.
remarkable.
That was very remarkable. And so that was what, because it was supposed to be not true, by it was not even accepted by ICMR when we presented it to them. ICMR really did not believe us. And then, of course, it was because I think Dr. Soumya Swaminathan was quite strong, and like, behind it. It went through the process, and then the Belgavi unit of ICMR took up that study independently. They completely kept us out, so that there is no influence of our thoughts in that. And they did that study independently in Belgavi, and found the same result, because Belgavi is
So
also an endemic place for dengue.
right, for dengue. So the thing is, so this has been several years since you brought it up to ICMR. They have tested it and independently and verified that it works. But now, I know of people who have had dengue, within your, like, relatives, friend circle. There are people who have, time to time, there's dengue that you hear about. I don't hear of any of them getting this treatment. And I have not heard of this, something that was actually proved and evidence-based. It's really unfortunate that there is this treatment that exists, is successful, and yet it's not being spread. It isn't being propagated. That's such a pity. I don't know what we can do to change that.
I think that is where you require a lot of effort, because we require like we require a change in the thought process, and in the infrastructure of health delivery. Because at present, health delivery seems to be more, first of all, health delivery seems to be more disease oriented, because we are talking about disease management than health management here, nowadays. So why do you go to a hospital? Because you have a disease. Why do you go to a health center? Because you have a disease. Why do you go to a health and wellness clinic? Because you have a disease. So you have to be sick to go to a wellness center. And how will you ever get wellness when you are sick? So it's quite absurd. It is not fitting anywhere. So I think the society has to change to look at health as something which needs to be preserved, which needs to be promoted, and disease as something which, of course, is taken care of in hospitals, where where, of course, right now, um, mm, we are focusing. When I say where it should be treated in hospitals, I mean, we are focusing on disease right now. We only have hospitals. Even for the namesake health and wellness clinics that we have are also focusing on diseases. So that should be separated. That is the first thing that has to happen. Second, the knowledge and usefulness to humanity it should be the primary focus, rather than silos, or silos of silos of um, um, silos of knowledge, which people think that it belongs to us, doesn't belong to us. Like the other in the knowledge should be taken away. Like there is no other in knowledge. All knowledge is the same. Like now I see that people consider if they don't understand what somebody else is saying, then they are considered to be other. Like there is
Everything in this world has now become about identity, whether
exactly.
it is about identity as based on some political affiliations, religion, or identity about allopath versus Ayurveda, right?
Exactly. So that's a big problem. I think I hope that it changes.